So many dementia patients live out the rest of their lives without truly being able to live. They're given medications as treatment for the dementia, but these medications often have side effects that worsen their dementia even more. As a nursing assistant student, I get to care for dementia patients, and I also get to see how dementia affects their daily lives. But I've also seen how music therapy can awaken them again by bringing back their emotions, their feelings, giving them joy, and even sparking memories that they have experienced in the past and allowing them to reconnect with the present. And I want to be able to prove to you guys that Medicare or Medicaid should sponsor music therapy as a treatment for dementia. And in order to do this, I'm going to first explain what dementia is, then we will cover what music therapy is, and then I'm going to compare music therapy to the traditional practices used to treat dementia. So our first point is, what is dementia? Well, if you don't know what dementia is, the American Association for Alzheimer's defines dementia as an overall term for diseases and conditions characterized by a decline in memory, language, and problem solving. And so memory loss is a perfect example of dementia itself. Some dementia side effects may start off with short-term memory loss, not really being able to remember appointment times that you've made, not remembering to do daily tasks, or maybe even misplacing things, and even wandering around, not knowing where you're going, just walking and stuff can be an example of some side effects of dementia when it starts. Now, these side effects might start off as being mild at first, but they tend to get very severe once the dementia progresses even more. So now you may be wondering, who is at risk for dementia and what causes dementia? Well, genetics and older age are definitely risk factors of dementia. So people who are over the age of 60, or if they have family history of dementia, are most likely they're more likely to be diagnosed with dementia. And dementia is caused when there is damage to the brain. And so what happens is brain cells get damaged in one area of the brain that the dementia affects. And these cells aren't able to send signals back to each other effectively the way that they should be. And because of this, a lot of dementia patients face cognitive behavioral issues. And dementia, it can be treated, but it cannot be cured. So now that we understand some things about dementia, I want to go into what is music therapy. Well, the American Music Therapy Association defines music therapy as the clinical and evidence-based use of musical interventions to accomplish individualized goals within a therapeutic relationship by credentialed professionals who have completed an approved music therapy program. The association also goes on to say that music can promote wellness, manage stress, alleviate pain, express feelings, enhance memory, improve communication, and even promote physical rehabilitation. And the way that music therapy works is it is able to stimulate so many different parts of the brain. So like I mentioned a few moments ago, dementia usually affects one area of the brain. Well, with music therapy, the other parts of the brain that aren't affected by the dementia are able to be stimulated, which is why these residents and patients who use music therapy, they're able to experience emotions for the first time again, or experience feelings. They're able to rejog memories that they've experienced in the past, and it brings them back to the present moment. And so now I just kind of want to compare music therapy to traditional medications. So I want to bring up a study that occurred in 1986, and there was a researcher who conducted an experiment where he brought music therapy to residents who lived in different long-term care facilities, and he studied their physical characteristics that changed while they listened to music. He discovered that physical responses such as eye blinking, breathing, heart rate, and mouth movement actually changed in a positive way, just because those areas of the brain that send signals to your body to do those tasks were stimulated again, and so the resident was able to have more physical movement. Leading more into medications now. According to the University of San Francisco, common medications given to dementia patients can cause tiredness, sleeping problems, vivid dreams, muscle cramps, headaches, constipation, and confusion. And obviously, reading off these different side effects of these medications is kind of alarming, just because dementia patients, like I said, already struggle with memory loss. They have confusion, they already are tired, they can have hallucinations by themselves with the dementia. And so it's confusing for healthcare professionals to observe a resident who has dementia when these side effects progress, because they don't know if the dementia itself is progressing within the individual or if the medications are just causing these side effects to be worse. And I think it's also important to observe the cost effectiveness of music therapy. So the US spends around $4,056 per individual every year to fund medications for people who have dementia. And there are about 3 million new cases of dementia every year in the US. So our government is spending a ton of money funding medications as treatment. But music therapy can cost about $35 an hour for a session with a trained professional to play music for the individual who has dementia. And also, if this isn't really an option or if that's too costly, then an iPod can be bought with a set of headphones and some downloaded music for about $100, and that resident can listen to music whenever they want to, whenever their care professionals help them to listen to the music. And it's just obviously a lot more cost effective because this iPod can stay with that resident or patient for as long as it lasts, which is most likely a really long time compared to the US spending the $4,056 for every person who has dementia every year. And even though the FDA has not approved of music therapy, just because music therapy is not a medication, it's not a medical device, I think even if the FDA does not approve of it as being an actual treatment, I strongly believe that Medicare or Medicaid should sponsor music therapy, just because, again, these patients who have dementia, even like they have dementia and they're not able to be fully coherent of their surroundings, but they're still human and they should have the rights to be able to experience feelings again if that's an option for them, to experience their emotions again, to experience all the memories that they've enjoyed in the past. They have the right to experience those things again. And so if music therapy can spark that within a person, why aren't we allowing music therapy to be a treatment for these individuals who have dementia? And I just want to encourage you guys, if you know anybody who has dementia, to just bring some music into their lives and see how music can just awaken them and awaken their souls and bring them back to the present moment. Thank you for watching.